Hey everybody, happy Wednesday. I know 5:03, so I'm a little delayed here, so I apologize. I want to welcome you if you've been on the conversation in the class previously. I want to welcome you back. If you're new to the class, I want to take the opportunity to welcome you. My name's Dr. Roney. I host the webinar, the conversation each week. So so just wanted to introduce myself and welcome you. Okay, so tonight we're going to talk about a really important topic within the causes of cancer, the pillar 4 that we talk about, and that's going to be on the hormones. So what I'll do tonight is I'll walk you through a little bit of the functional medicine approach to hormones, and then I'm going to have Dr. Keneally on to make sure that she talks you through the cancer part of it. So I'll give you some generals with hormone replacement therapy and what hormones do and how they're important for the body, and then what to look out for, and give you some key pearls, is what I would say. And then I'll have her really come in and answer questions on the hormone part. So one of the things that with cancer and hormones that I do want her to address, we see a lot of patients that are on hormone blockers. And I want her to answer when and why those are appropriate, and when to do those and why to do those and when you would not do those. And then also, can we give hormone replacement therapy while somebody has cancer, right? And again, it could be prostate or breast or uterine or any of those. Any cancer is driven a lot of times by estrogen. So she'll go over that part and really relate those things together for you as well. So as I always do, if you're new to the class, I always do a review to try to catch you up from what we've done, either the previous class or the previous classes or conversation. So I will do that for you. We'll walk you through what we call the 4-pillar approach. Pillar 1 is going to be the testing that we do and why we do it. Pillar 2 is going to be how do we kill the cancer cells? How do we starve them? How do we and why do we alkalize the body? Why do we oxygenate it? And those are all within pillar 2. So kill, starve, oxygenate, alkalize. We do pillar 3, which is your immune boosters, and I'll explain those. And then pillar 4, which is trying to peel back the layers of the onion that have potentially caused the cancer. So as you hear me say week in and week out, the 4 pillars is really I always say if I'm going to try to tell you my truth or tell you, a biasness, it's to the plan, right? It's not necessarily here, although here I think we do a wonderful job because it's very complete, and I'll explain that. But it's the plan. The 4 pillars is really, really strong and really, really good and really, really detailed, and that gives you the best chance to heal by far. Okay, so let me pull up the screen. Let me share it, and we'll go through the PowerPoint, and then Dr. Keneally will be up in a little bit, and we'll go through her part of it as well. So we always talk about, who we are. We have a 30,000 square foot facility here in Irvine, California. Half of it is designated to a wellness center, and half of it is integrative cancer care. So the Cancer Center for Healing, and then the other side is the center side, which again, we see wellness, we see autoimmunes, we see, just a myriad of different functional medicine type of cases that we work on from a cause versus effect standpoint. So good clinic that way as well. Okay, my bio's there, 20 years experience in the world of functional medicine, and so forth. So I started chiro, sports medicine bio, got my chiro degree because I was working with athletes and I wanted that as part of my tool in the toolbox to help my athletes. And then I really learned that if I'm going to get people better or functioning at an optimal level, I have to work at the cellular level from the inside out. And that's in probably 2001, 2002, went back to school for functional medicine and really learned about all these different causes as to why we're kind of one of the unhealthiest nations in the world. And instead of just band-aiding it with medicines or what have you, we want to try to fix the problem. And that goes into pillar number 4, which is what caused the cancer in the first place. So that's where I get involved quite heavily. Okay. And then Dr. Keneally, you all know her. And then if you don't, she's the founder of the clinic, 35 years experience in this functional medicine world, integrative cancer world. So she's kind of the guru, if you will. So let's go back and go over the pillars so you understand the review part. And what I'd like to do tonight is give you an idea of what I've done with a loved one that's going through the same process that you all are going through. And I'll be very specific, and I'll give you the understanding and the idea of why we're doing what we're doing. And I think that will relate a little bit better and tie things together. So this person was diagnosed with breast cancer and had a small nodule and a small tumor that was found via routine MRI that she was doing, and then had the diagnosis. We were referred to a surgeon, went to the surgeon, and the surgeon basically said, look, this will be fairly easy. We're going to remove the tumor via lumpectomy. And then they recommended 3 weeks of targeted radiation, and then potentially using these hormone blockers as well. So let me walk you through what we did. So number one, the question that I asked if you've been with me at the clinic, I always want to know what the benefit versus the risk of any proposition or any modality or any treatment. So I always weigh it as, where's the benefit? Where's the risk? Does the benefit outweigh the risk? So when we asked the doctor about the lumpectomy, first and foremost, they said it's a very high chance that when we go in there, we get it all. And it creates, in cancer, they give you a 5-year survival rate. That's their parameter. And she said it's extremely high that if we get this out, that the 5-year survival rate is through the roof, in the mid, maybe 90 percentile or whatever, very high. And they said if we back it up with 3 weeks of targeted radiation, it's even higher. So the healing with a lumpectomy and targeted radiation is very, very high. And so that was a benefit versus risk proposition that we talked about. And that's what we went with, right? Because the benefit well outweighed the risk. Okay, so I get a lot of questions on, should I do this and should I do that? I always go back to, well, what's the benefit? What's the risk? So one of the things that I would say is always ask the doctor, well, if I do this, what's the benefit? What are my chances versus what's the downside? And I think that helps you make a decision much easier. And then the follow-up to that was, well, we also are recommending blocking the hormones, your estrogen, with something called either tamoxifen or an estradiol. Dr. Keneally will talk about that in just a little bit. And so when I asked the follow-up question of, well, what percentage will that give us more? And as far as healing, the doctor said, in this case, maybe 1 or 2%. And so then we researched, and from my background, I didn't have to do much, but I researched the downside of having estrogen being blocked, and the downside was pretty high. Dr. Keneally will talk about this. We need, especially women, need estrogen, right? It's a huge part of optimal function. The problem is not necessarily the estrogens per se. It's the bad estrogens, it's the xenoestrogens, it's estrogen dominance. Those are all things that play a big factor as well. So we have to take all that into consideration. The point I'll make is, and this is just what we did, is we decided that the percentages of using the estrogen blocker was not enough. The benefit didn't outweigh the risk. So this person decided not to do them, and there's other things that they decided to do to help with the hormone balance. That's Dr. Keneally will talk about that. So again, what did we do? We looked at these 4 pillars, right? We looked at the testing, we looked at the treatments, we looked at the boosting, we looked at the looking to address the causes. So in the 4 pillars, pillar 2 is, how do we kill the cancer cells, right? Well, in this situation, we decided to do conventional lumpectomy and radiation simply because the percentages were so great, right? Now, here's what we did in addition when we're looking at these different pillars. We then I had the person come here and we did the RGCC test. Why did we do the RGCC test? Well, we wanted to know in case future, any chemo agents that the body's going to be most sensitive to, we wanted that knowledge, right? Number two, we wanted to find out the natural agents that this person's body was most sensitive to. And we also wanted to know if she had any circulating tumor cells. Okay. So in this case, the circulating tumor cells were zero. Thank goodness, right? So everything, now let me back up. If we didn't do the circulating tumor cells and the conventional model said, hey, everything's good, well, how do we know everything's good, right? Because the scans and the tests say it. Well, the RGCC allows you to go deeper and to get more data that they're not using to figure out if she did have any circulating tumor cells. Now they were zero, but we have patients that come back that did the conventional model, was told everything's good. We do the RGCC and the circulating tumor cells are elevated. Now we still have a problem that we need to deal with where we're not going, oh, you're fine, everything's good, right? So that's what the RGCC helps with in a case like that. For others, we want to know sensitivity testing to the chemo agents, to the repurposed drugs, to the natural agents, and we want to know the circulating tumor cells. We want to know all that to get specific with your plan, right? We don't want to guess. And I think in the model of cancer care today, there's way too much guessing, right? I would rather have a plan. I know I say this every week, and I apologize for being redundant if you've been on every week. I would rather have as much data to guide me as I possibly can. And that's what these tests do. So in addition, you'll see it on there, you'll have your PET scans and CAT scans and things like that. All that's important, right? But RGCC is by far one of the tests that I would do all day, every day personally, because it gives me specific information about me or a loved one or whomever. And for you too, that's what I would recommend. Nagalase is an enzyme that it's secreted by the cancer cell. It basically blocks macrophages or your immune system from attacking the cancer cell. So if that's elevated, we want to know about that so we can bring that down, right? That's another test that we do. The PHI, it's an enzyme that basically tells if your cancer's anaerobic, low oxygen. And if that's elevated, then we want to use that to our advantage and give you things like hyperbaric or ozone therapy that can bring the oxygen up and create an environment that's less conducive for cancer to survive, right? Obvious stuff. So, and then D-dimer is another one that we look at, that if it's elevated, it tells us the cancer might be moving. You have extra coagulation factors. We want to bring that down. We use the cancer antigens, etc. The point I'll make very quickly, gang, is those tests in pillar number one are allowing us to create a comprehensive, individualized plan. So it's one thing to have a comprehensive plan, but it's another thing to have a very individualized plan. So again, this person that I'm telling you about that I explained just in the beginning, we did, getting us into pillar number two. Let me explain. So pillar number two is going to be starve the cancer, kill the cancer cells, oxygenate, and alkalize. Now in the kill phase, that could be chemo, it could be radiation, it could be surgery, it could be fractionated chemo, which we do here. We use lower dose of the chemo, of the strength of the chemo. We bring the blood sugar down and basically use the chemo agents from the RGCC that you're most sensitive to, that'll work best for you. And we infuse them when the blood sugar is down. What that does is the chemo acts like a heat-seeking missile to go after the cancer cells, but it leaves a lot of the surrounding tissue intact, right? A lot of patients opt for that option simply because it's less invasive and detrimental to the system. It still has a profound impact on the cancer cells, but it doesn't create a major catabolic situation in your body. And when I say catabolic, I mean it doesn't keep just breaking you down. Okay, so the kill phase of these cancer cells could be, for some people, like we did, conventional, right? But however, we then followed it up with doing the right testing. So all the tests that I just mentioned, we did. And then we went and that person is coming here consistently. They're doing their IVs, their immune system, vitamin C, mistletoes, and then they're working really diligently on figuring out what happened. So we did 24-hour urine tests for hormones and metabolites. We tested stress levels. We tested chemicals. We did mycotoxins. We looked for viruses and infections in the body. So we're in that process of going through now all the causes. So we feel like we've got a good handle on the cancer and the cancer cells. Now we're boosting the immune system and we're looking at all those different causes that may have contributed. So again, gang, the decisions that you make within pillar number 2 are going to be dependent upon what the labs show. Is it super aggressive and we have to start everything right away, or is it less aggressive and we have a little bit of room, a wiggle room to work through a plan, right? It just depends. So what we recommend in pillar number 2, killing the cancer cells, will a lot of times be dependent upon what we see and what you want as a patient. So I have a lot of patients, I have one or two today actually, that said, don't want chemo, not going to do full dose chemo, but they have somewhat of an aggressive form of cancer. So what we recommended was the deductive answer, which is fractionated chemo. And they're going to do it. They're going to do that. They did all their testing already. They're going to do that. They're going to do ozone therapy to oxygenate. They're going to do alkalizing IVs to get their body more in an alkaline state. And they're going to do hyperthermia, which is a modality that helps kill the cancer cells. And then they're also going to work step by step on the causes of their cancer. So again, it really depends on what's presented as to what we recommend. But the 4 pillars, I don't care where you do it, that's the answer, okay? Because as I will tell you from a clinician and a patient, right, helping this person, I did the research. So I went around, I did all the Google searches, even though I know what we have, I wanted to make sure that what we had compared to where everybody else, I wanted to compare. It wasn't even close. The amount of things that we have under one roof here is by far the best. We have a lot of patients that try to piecemeal, like, oh, I'll use this information and I'll do this here and do this here. They almost always end up here eventually because they find they have to be the one that's coordinating everything. They have multiple doctors involved, that this doctor, they're going for this, and this clinic, they're doing that, and they just can't do it. So they lose the integrity of the plan because they're trying to piecemeal it. Now, I get it, out of state, have the dollars and cents always matter, but if you can do the plan here and do it exactly the way we talk about, it's as thorough, I think personally, as there is, because I've just done the research. So that's my opinion, but it's based on the research that I did just in the last 6 months. So, and then being here every day and seeing. So pillar 3 is the immune boosters. Pillar 4 is identifying the underlying causes, right? So if you look at this slide here, and all these causes here are what we've been talking about in the class over the last few weeks after we got through pillar 1, pillar 2, and pillar 3, right? We've already done those. I kind of reviewed those with you a little bit tonight, but all these different things, if I have blood sugar issues, right? You see here, if I have sedentary lifestyle, weakened immune system, poor diet, and I'm deficient on my macros, which is protein, carbs, and fats. If I have vitamin deficiencies, mineral deficiencies, if I have environmental issues, smoking, alcohol, environmental toxins, acidity, right? Stress, chronic inflammation, obesity, genetics, which we'll get into in a future class, which is, they call it SNPs, these single nuclear polymorphisms. We're gonna go through all that, the gene expression, the what they call phenotypes. We're gonna hit those as well. So all these different things nowadays, we're just overrun. It's all of it that could be creating the problem. So we need to go with each patient with a checklist step by step, identify these things that could be creating the problem, test them, and then really simply go checklist. If it's a yes, it's over here. If it's a no, over here. And then we figure out priority wise how to address each one of those things that we found that could be creating your cancer. So again, as long as we do all those things within the 4 pillars, it's going to give you the best chance. Now, caveat is always this: nothing is ever foolproof, right? Nothing in the conventional model, in this model. But what it does, in my opinion, if you look at the other models and compare, they're doing one chapter of a 30 chapter book, right? We're going to fill in the other 29 chapters. And that's how it's going to be enable us or enable you to create a high level of healing by maximizing your upside and minimizing your downside. Okay. That's just, again, gang, just went through it. I'm telling you how I did it step by step, why I did it. I share that with my patients as much as I possibly can, because sometimes they just need the understanding of, okay, what am I doing? Why am I doing it? And given the rationale as to why certain decisions are being made. Okay. The other thing, and I appreciate you all telling me this because I hear it every day, this conversation, the meetings with me, meetings with some of the other the advisors or the advocates, what they do is create a sense of calm, right? Because I had one patient, she's kind of the caretaker for the husband, and she said, being here and going through the class and sitting with me and going through step by step, she said, I don't have to do all the worrying and thinking. You all are doing it for me. And that is exactly what the class is designed to do, gang. It is designed to give you power, right? The more information you have, the more power you have. And the more power you have, the less anxiety and fear you're going to have, right? It's the best, one of the best things we can do for you, in addition to treating you, right? And with all the details of the 4-pillar, one of the best things we could do with the plan as we articulate it, if I do a good job articulating it to you, is a sense of calm. If you're in sympathetic overload constantly because you're worrying, you're fearful, anxiety, it's a very difficult environment to heal in, which you all probably know. So more and more and more from an education standpoint is going to help you significantly. And that's why we do it for the most part. Okay. All right. So let's talk about these hormones. Okay. So Dr. Keneally will probably be up shortly. So I want to give you an overview functionally. So over the last 15, 20 years of doing as many classes and courses as I have, the number one thing I've learned with hormones is this, and I want you to have this as a takeaway, write it down. If you have hormonal imbalances, it's almost never, right? I'll say almost never primary, which means you don't just have low progesterone, or you don't just have low testosterone, or you don't just have low estrogen or high estrogen or whatever, right? You don't just have high or low thyroid hormone. You don't have high or low cortisol. There's always going to be a cause that is creating the imbalance. Okay. It's the number one thing I've learned. And I'll give you some examples. So if you do have imbalances in your hormones, you always have to ask why, right? Now, let me back up and give you a caveat. As we age, we are going to lose hormones. That's a fact. We shouldn't lose them like this, right? They shouldn't fall off a cliff and be totally low. There's age variance that we want to look at as far as parameters, but the reality is they go down like this, and usually function is not distorted as a result of us aging and losing some hormones, right? So if we're starting with that knowledge base, then we understand that, okay, if I do have imbalances, no matter what age, and dramatic imbalances, then there's something that's causing them. Okay. So as an example, stress is one of the number one causes of hormone imbalance, men or women. Okay. If I have elevated cortisol, and then over time, I'm in a chronic stress, I'll have low cortisol, my body is going to have to use certain hormones to convert to cortisol, because cortisol is a hierarchy hormone, right? So I'll see lower levels of DHEA, pregnenolone. I'll see lower levels of progesterone, right? A lot of times. And then that sets up what they call a progesterone estrogen imbalance. And I have estrogen dominance. Well, if I have estrogen dominance, right, I'm going to have a higher chance or predisposition to create proliferation of my breast tissue, my uterine tissue, prostate tissue, etc. And again, I'll let Dr. Keneally get into that. But That's what's going to happen if I have these imbalances. But the point I'll make with that particular case is stress created the hormone imbalance, right? I could have, if I have elevated blood sugar, males, we see this a lot with males. And again, I'm just giving you a couple examples here. If I have elevated blood sugar and I'm pre-diabetic or diabetic, what's going to happen is my testosterone is going to convert heavily to estrogen because I'm aromatizing my testosterone. So the point is, my testosterone might be low and we might work on your testosterone, but the blood sugar is creating the problem. So we don't just want to stop there. We can band-aid it, but we definitely want to be able to correct the causes to your testosterone issue, right? And your estrogen issue by correcting the cause, which in this example is elevated blood sugar. All right, here's the I call her the queen bee, the queen
Hi,
bee, and the
everyone.
king too. She's everything.
Yeah.
So, Dr. Keneally, everybody.
Hello, everyone. Great that everyone is here. You guys are changing the world because you're here listening to our important information. And you hopefully are sharing it with your family and your friends and anyone that will listen to you. Because we really have to change and transform the landscape of medicine. I know tonight is hormones. Hormones are my most favorite topic, okay? And the reason they are is I had a lot of hormonal problems. And as most of you know, my mother took DES when she was pregnant with me. And so I started going to cancer hospitals when I was 16 years old. And I never had 2 periods in a row in my life. And so I went to go see conventional doctors because that's all there were. And of course, they gave me birth control pills because that's what they give people to regulate their menstrual cycles. Well, that was a life-changing experience because, I mean, literally my whole body changed taking birth control pills for the first time in my life. Anyway, the bottom line is I finally found progesterone, and progesterone saved my life, literally. And I remember when I was in medical school, I would read Guyton Physiology. It's a famous book, Guyton Physiology. Every medical student reads it. Yes. And I would read the same page 10 times. I'm like, what did I read? Because when your hormones are out of balance, everything's out of balance. Your brain can't work, your digestive can't work, heart can't work, nothing can work. And so it is critically important that everyone has their hormone balance at every stage of life. Now, usually I used to say that patients had a warranty on their health at age 40 until age 40. But I can tell you right now that I can't say that because I am seeing younger and younger patients with hormonal problems and of course cancer. And so I would say even like just today, I had a 39-year-old girl who was diagnosed with lung cancer a year ago after complaining about a cough for 1 year. And then it took her another 6 months to diagnose the lung cancer. Now she's 39 years old. Can you imagine? 39 years of age and has lung cancer. So I can't say that anymore. But before, years ago, when I had young people, and I remember very, very clearly, I had this young boy, he was like 20 years of age, and he had an anxiety disorder. And so I said, you know, I think I better check his hormones. And sure enough, he had the testosterone of an 80-year-old person. So one of the biggest things that testosterone helps is the brain and its function and its mental balance that it provides for a man and also a woman, believe it or not. All women and all men have the same hormones, except men, for example, have higher testosterone and women have higher estrogen. So if you look in this diagram right here, you're going to see the major hormonal players, okay? These aren't all the hormones because we haven't even discovered, if you look under the adrenal glands, which is on the left-hand side, which is the adrenal glands, to me are probably the most important glands, because if you don't have your adrenal, you wouldn't be alive. Now, the same goes for the thyroid too, but every hormone is important, right? I mean, I can't say that one hormone, but you can live without, like certain, you can live without your thyroid gland and take, thyroid replacement, but you can't live without your adrenal gland. And the adrenal alone makes over 100 hormones. They still have not discovered all the hormones. That's why we focus on fixing and supporting the adrenals, because it makes so many hormones.
And they're your stress glands, by the way.
Right. So if you have stress, and of course we all have stress, we all are affected by our adrenals. That's why we're a big proponent of balancing the adrenals. And when I say balance, is because when you're stressed, you kind of have a roller coaster. So Dr. Roney, did you talk about all the main hormones?
I didn't.
Yeah. Okay. So here are the main hormonal players: estradiol, progesterone, testosterone, DHEA, thyroid, cortisol and growth hormone, melatonin, pregnenolone, androstenedione, and oxytocin. And so these are the main ones that are functioning. But you can see in the diagram, here's all the hormones. So you have something called the hypothalamus. So the hypothalamus, I call it the brain's brain. And so the hypothalamus is the gland in your body, in your brain, that sends messages to the pituitary gland. And so the hypothalamus produces releasing hormones. Releasing hormones are hormones that send messages to your pituitary gland to make all of these hormones, all right? And then those stimulating hormones stimulate every organ that's listed, you can diagram here. And so unfortunately, the more stress we have, the more the hypothalamic gets dysregulated through toxicity, through stress, through nutrition, everything. So it's very important as a physician. I don't care what medical problem you have or you don't have. It is critical for every patient. That's why we always check hormones on every patient, the big players that we're looking at. Like, for example, if a patient has prostate cancer, they just check PSA and a few things, but we check every hormone. We check the FSH and LH. I mean, we are checking everything. So here we have to know your hormones, because these are the chemical messages that turn a cell on and off and regulate every cell in your cycle, in your body. And so it's very important that we know these hormones, we know that they're balanced, and we know how to correct the imbalances.
Real quick, Doc, a lot of patients are on the adaptogens.
Uh-huh.
So the adaptogens, gang, are what help the hypothalamus and the pituitary connect to your cells, right? So they'll do a better job of regulating your hormones from a stress standpoint. The ashwagandhas, the cordyceps, the ginsengs, right? Things like that some of you may be aware of, but that's why we would give them to you, because we want to get that hypothalamic pituitary axis, they call it, regulated better.
Right,
So
very important. That's why meditation is so important. Right. I always tell patients meditation is medication. And I know we all have a lot to do, even myself, but I always have to try to find time, even if it's 5 minutes. It's an important thing for us to institute in our activities of daily living, that we really, really can have so much benefit. We should do a whole class on meditation.
Agree.
All right, so let's go to the next slide. Okay, so I already went through very important in any disease process, and more importantly, human optimization. One of my big things now today, of course, taking care of patients, but I want to optimize every single patient, whether they have cancer or whatever reason they come in. I want to optimize them to be the best. That's what I'm doing on myself right now, all the time. I'm at an age now where I have to do more, and I'm always embarking on what's the next thing I need to do, because the knowledge that's coming out now is just growing like unbelievable,
Infinitely, it is.
infinite. And
Yeah.
so I'm always interested because I want to live till I'm 123. And so I read about the Japanese lady yesterday. She's the longest living person. She lived to 119.
No way.
Yes.
Wow.
And so anyway, so see, it's possible.
That's right.
Anyway, so of course your hormones are not going to work if you do not have proper nutritional sufficiency and you don't have the right eating. So a lot of people like maybe go on just vegetarian and they don't supply their body with proteins like protein powders or protein and sufficient protein. So if you don't have sufficient protein, you can't make hormones. You can't make good muscle. So here are, I said proteins the first one. So phospholipids is phosphatidylcholine. And we do that IV. I personally take it orally every day because it's like an anti-aging. So let me describe, here's a cell. And the wall of every cell is made up of essential fatty acids. They call them essential because you must have them, and phosphatidylcholine. So the essential fatty acids are the bricks and the cement is the phosphatidylcholine. So you kind of need both. In fact, we just started recently in the last 6 months doing IV phosphatidylcholine for patients who do chemo so that we can clean out their liver and brain, but patients with heart disease, and it's a great anti-aging. Zinc is very important, like for males, very important for zinc is great for testicular production of your hormones. Vitamin D influences over 3,000 genes. A, iodine, selenium, all these are important for your thyroid gland. Magnesium's involved in 400 chemical reactions in your body. So these are all very just critical nutrients. That's why everyone that we have here does the NutriEval that Dr. Roney reviews with every patient.
Correct.
Okay, so estrogen. So estrogen, believe it or not, men make estrogen and so do women. And estrogen's important for day-to-day functioning. It affects everything. That's why, you know, when women have like PMS, they have too much hunger, probably because their estrogen's totally out of control. And so, but it affects digestion, brain function, heart function, neurological function, skin function, I mean, everything. And so it's very important that we have balance. Now, if we have estrogen out of balance, which happens, believe it or not, through the estrogen dominance of your own physiological production because you have an imbalance, or you're getting so many estrogen dominance from the environment. And so there's so many. I was reading an article just quickly this morning about your dishwashing soap has phthalates in it. Mm-hmm. And so that's why it's very important that if you use dishwashing soap, you need to make sure that it's a non-toxic virgin. All right. Yeah. There we go. So estrogen dominance, okay, we know in breast cancer, which is the #1 cancer today, is breast cancer. And so estrogen dominance, and when you get your pathology report, it will say estrogen receptor positive or estrogen receptor negative, okay? So what does that mean? What that means is that estrogen will be one of the possible feeding for the cancer to grow. So that's usually why they will implement some kind of estrogen blockade. There's multiple drugs. The primary drugs are anastrozole for women who are postmenopausal and tamoxifen for women that are not in menopause. And I will implement those usually in the beginning, depending obviously for the tamoxifen for the younger patients, and the patients, like I said, who are in menopause, I will use that because I always explain to patients that cancer is like 100 leaks in the roof, and it's a tornado, rainstorm, and hurricane. And we have to seal every deficiency going on. And otherwise, if we don't, we are not creating this bulletproof anti-cancer environment. So, what are the reasons why is, okay, malnutrition, because your body cannot produce what it needs to do and metabolize what it needs to do. Obesity, what happens is when people are obese, men and women, their fat acts as an organ in of itself and stores estrogen, okay? And what happens is we have all this inflammation, all of this inflammation goes through the liver. The liver cannot metabolize all of the things, all the toxicity and all of the estrogen and the estrogen metabolites and all the estrogen toxins, they call them xenoestrogens, in the environment. And then we add medications to that. That's why 50% of the population has something called fatty liver. 50%, doesn't matter if you drink or not. So an estrogen, when it's too high, it can cause dysregulation with our stress levels, and it's immunosuppressive.
What's it do to the proliferation?
Oh, well, estrogen makes everything grow.
Right.
And so everything grow when it's in the imbalance. Like as guys age, I think Dr. Roney was talking about this when I came in, is that as men age, they have an enzyme called aromatase, and aromatase causes the production of more estrogen in men. That's why we should always be checking estradiol in men, no matter what. It doesn't matter that it doesn't have to be in a prostate cancer setting. It could be in any setting, because I tell people, if you don't check, you're guessing. And so in the world today, in the last 30 years, our world has gone unchecked and imbalanced, with nobody checking what all this, environment that we're living in today, with new food, new pollutants, new chemicals, new EMFs, and all these things, and what this is doing to our system.
You mentioned a few days ago, and I've heard you say this before, estrogens, right? From a cancer standpoint, all cancers have an estrogen component. Is that
right?
Correct?
Like, a lot of people don't realize it's not just breast. It can be lung cancer, it can be ovarian cancer, it could be tubal, like fallopian tube, ovarian. Lots of hormones can have lots of cancers can have estrogenic activity. And so, like, I had a patient, I'll give you an example. A woman came to see me for fallopian tube cancer, and she had just been diagnosed. This was about 7 years ago. And so I said, well, is it estrogen dominant or not? And she said, or estrogen positive. And she goes, well, no, they never mentioned. I said, go back to your surgeon. I want to know if it's estrogen positive. Well, sure enough, it was. So that means here she is, a menopausal. For sure, I can't give her estrogen. And so she's doing fine, but the doctor should have automatically checked that, So every patient, I always ask when they have any female cancer, endometrial cancer, fallopian tube cancer, ovarian cancer, all of them, if there could be an estrogen component, because we don't want to inappropriately feed the cancer with external estrogen.
And going back to your point, the estrogens, we're seeing them elevated more and more, and pretty much, I don't want to say across the board, but quite right. That's fair.
Yeah,
especially, and it's because of all the things that cause them.
Right, exactly.
To go up. Stress,
xenoestrogens, fatty liver, all
obesity.
This. Yeah, it's a lot of imbalances, and they're underground imbalances. That's why conventional medicine, they're just looking, they don't even check estradiol in men like we do, in total estrogens, like in men and women. And we are just doing like minimal blood work on patients, meaning I'm talking at other places.
Right.
But that's why we have to do comprehensive testing to know as much information as possible.
Gang, these are the details in Pillar 4 which when we talk about causes, it's not just, oh, we're going to look at the causes. We're literally going so deep into the details of it. So if we do see elevated estrogen, the next question is, well, what's causing it? And there could be 5 different causes. Is that fair? I
Right.
mean, just as an
10,
example, 10.
20.
Yeah.
Yeah.
So again, it's really the details. Okay.
All right. So if you have too much estrogen, I usually can tell if a woman has estrogen dominance because you can kind of tell by their build, and because they tend to put on weight in different areas of their body. Their cholesterol will be higher. Their HDL, which is your good cholesterol, that's going to be lower. Your triglycerides, because that's having to do with your eating and your liver, proper metabolism there. Elevated cortisol, because elevated cortisol interferes with the balance of all the hormones. So you have elevated cortisol, you throw off your thyroid, and then you throw off all your female hormones. And so then decreased growth hormone also, and insulin resistance, because the more stress you have, you're going to have a roller coaster with your insulin, because every time cortisol goes up, it causes you to make more sugar, more sugar. You tell your body it's starving, and then the whole thing goes back and, up and down. That's why it is really critical that we, all of us, learn how to control and, get our stress under control or balance, because stress is part of life, and it's actually a necessary part of life of surviving.
Yeah.
But we just all have to take it in stride, talk to someone, do meditate,
exercise.
do any kind of emotional healing that you can think, pray, all kind of things.
Now,
All
this one of the heading on this was the prolonged progesterone. Say you're using progesterone without adequate estrogen. Tell a little bit about that and how that would
Okay,
affect.
so in a woman who is not menopausal, okay, and I see a lot of this now, is that, so you primarily, your cycle's about 28 days. You bleed for 3 to 5 days. Then you make estrogen. Then you make ovulation, so your FSH and LH change. Then your progesterone kicks in. Your progesterone kicks in for about 2 weeks. So you can easily test this by checking a saliva monthly cycle. So you check your hormones every other day, or you can do a blood test at the beginning of the cycle, day 3, 4, 5, and on day 18, and you can see what your hormones are like. And so if you have any part of your cycle where there's not adequate amount of progesterone, all right. So personally, like for me, I started taking progesterone because I would be in this estrogen dominant stage all the time. I'd be making estrogen because I never had a period. I never had that cycle. So I started taking progesterone when I was like 30 years old. And so I've been on that literally for that long a time. Back then I had to give myself natural progesterone injections until I found time-release progesterone, which was one of the most life-saving things in my life. And I've been on that, still forever. Anyway, and so it's this unopposed estrogen. You've got all this estrogen and you have inadequate production of progesterone. So like, for example, there's a woman that comes into me and she goes, well, I'm on my 3rd miscarriage. Well, it's most likely they didn't have sustainable production of progesterone. So we have to check this. We have to make sure, because that's abnormal for a woman to have sustained miscarriage like that. So, or if you have irregular bleeding, like if you start bleeding on day 23, we know you most likely don't have enough progesterone. If you have excessive bleeding, so like, let's say you have very, very heavy periods, and that means you probably don't have enough progesterone. Also, if you have fibroids, 30% of the population have fibroids. Those are those planetary uteruses that you're on your uterus. So that is a sign of estrogen dominance. If you have chronic breast cysts, that's a sign of estrogen dominance. Endometriosis. I mean, there are so many things that are related to estrogen dominance. I should make a note that we should send out like a whole list of everything that's related to estrogen dominance. I want you guys to see that, because I think it's very eye-opening, and we're living.
It's so common.
It's so common today, it's estrogen dominance. I mean, in men and women. It's
Mhm.
not just a womanly problem. This is a man problem too. And so, and then we also have to look and see how we metabolize to make sure we're not making bad estrogens that we're making going towards. So usually I check that later on with a
24
urinary
hour.
profile, but in the beginning, I want a baseline of what's going on right at that moment.
So you use blood initially, and then you'll get into the 24-hour urine test, physician's lab, something like that.
Right.
Or there's other.
Yeah, I tell people there are so many things that we can evaluate on a patient. I mean, it's staggering between mold testing and NutriValve testing and Candida testing and parasite testing and this testing. I mean, it can go on and on and on. And the most important thing is we got to work on getting the patient well faster. And so, and then we have to see how these things are working and then check things. But, you know, I tell people from the time you start, it's going to take a year and a half, depending if you have surgery, if you have chemo or radiation, because those derail us. Those are detours in our healing progress.
Yeah, and if we're working on pillar 4, which are the causes, we have a couple. It's like eating an elephant, right? You have to do it one bite at a time for many reasons, but without overwhelming the patient as well. Because you start finding mold, for example, that's a protocol in and of itself. We find candida, protocol in and of itself. So the point I'll make with that is if you're going through this process from an expectation standpoint of correcting the causes, think of it as eating an elephant. It's one bite at a time. It may take 6 months, 12 months, a year and a half.
Minimum 1 year. But I had a dentist last night. Okay, he has sarcoma. And so sarcoma is a tumor of muscle and bone.
Yep.
And under his arm. And so he had already had the sarcoma removed. And he is seeing an oncologist. And when I got all of his blood tests, he had mold and Lyme. And then I worked him up for cardiovascular disease because he had an elevated calcium score. And so we had elevated homocysteine. And I told him, I said, you're kind of a project. This is going to be a lot of work. Now he understands because he's a dentist and he's not a normal kind of dentist. He's a dentist that
integrated.
And he knows.
He loves this. Yeah.
Yeah. And
he's a good dude. Really good guy.
Yeah. So anyway, all right, let's go to the next slide.
All right. Progesterone.
So progesterone,
Protector.
It's interesting. So years ago, I will tell you that I went to Germany to study cancer. And I went and stayed there and worked in a cancer clinic and to see everything they did. Because there was a doctor by the name of Dr. Dowse who was lecturing here in the United States. And so I'm going to go there. I want to see everything they're doing. I want to interview every patient. So the Dr. Dowse is like 82 now. And so he told me, I said, well, how did you get into what you do? He says, well, my mother had renal cancer, which is kidney cancer. And so he said that, you know, he's looked the world over and he found this paper on progesterone for renal cancer. So his mother, he was like 30 years of age. He comes to Denver to see this doctor and he put her on super high doses of progesterone and got rid of her kidney cancer. And she lived for another 50 years. So progesterone is an anti-growth molecule. Okay. And it is, you know, one of those hormones that just helps control the balance of any kind of growth. So progesterone doesn't even have a negative side effect. Now, can everyone take progesterone? Just because something's good, that doesn't mean everybody needs to take it and everybody needs it. No. But, you know, it's a great, wonderful thing for brain injury. It's a great, wonderful thing for thyroid to work better. It's great for circulation. It's great for, like I said, balancing all the hormones, men and women. Like men who have prostate cancer, we use progesterone cream because the uterus, breast mimic the prostate very similarly. So, and even I use natural progesterone cream and or pills in women who have breast cancer, because it's anti-cancer and anti the growth of cancer. So, but not to mention, it helps with its natural redeeming qualities, which are neurological. It helps the bone, helps the skin, It helps, like I said, thyroid work better. It's just a beautiful molecule for a lot of different things. If anyone wants to read, one of the most prolific doctors is Dr. John Lee. He wrote many books on, he loved progesterone, but there's several, like I said, there's several people that really understand the magic of progesterone.
So
Anyway,
question at the bottom, right? Because one of the questions is, can a patient, they understand, I think most that I speak to, estrogen. They understand the estrogen thing, what I'll ask you a little bit about, but can they use progesterone with these cancers?
yes,
Okay.
absolutely.
Okay.
Absolutely. It's not, it's very different. The receptor protein is not the same as progesterone. And I use it, like I said, I've used it all the time. And if you're interested in our progesterone handout, which I've written up, you know, going over all kinds of studies. I don't know if you've seen it, Dr. Bonnie, but everything.
Yeah.
And I was at a conference speaking at a medical conference, and a doctor in the audience asked this question, and an oncologist quickly stood up and said, absolutely, you can use progesterone on a breast cancer PR positive diagnosis.
Bioidentical.
Yeah, bioidentical.
Yeah,
you don't want to
okay, no
use,
synthetic.
on hormones, you want to stick to biologically identical hormones. You don't want to use any kind of hormone that is not like nature. Okay, it's biologically similar to what your body makes.
Yeah, there's that study back, I think it was 2000. It was on Prometrian, and it was all these bad things. So a lot of the doctors like, oh, no progesterone, very bad, but it's synthetic progesterone.
Yeah, well, it's not quite the same. And one thing about progesterone, it is pulsed in your body. So when you use progesterone, you want to use it like we make it time released. So that's very much like the body. Or when you use a cream, your cream slowly, your body slowly picks up the progesterone. So I like I said, I love progesterone. I've been on it for 35 years. So.
Even if they're PR positive, I just want to make this clear. It's okay, because you said it's a different, right? The receptor protein is not the same.
It's not the same.
Yeah. So okay. And then one other question along that line. We talked about it earlier. The estrogen, when you're deciding whether or not to block the estrogen with a patient, the tamoxifen or the anastrozole, what is your, because they ask me every day about this.
Okay, so
right?
in the beginning, I always say we got to throw everything in the kitchen sink. So in the beginning, I may prescribe tamoxifen, I may prescribe anastrozole. Some of my patients are adamant about not using the medication. So my backup plan for someone who doesn't want to use medication is the herb Myomin. And Myomin is a great product to reduce your estrogen. And because sometimes I have patients who have side effects, personal reasons that they do not want to use medicated estrogen blocker. But like today, I had a patient come in this afternoon. She's estrogen receptor positive. I did the RGCC. She's had this. She was diagnosed 3 years ago, kind of been doing a little bit of this. She's new patient to us. And so I said, I think, it's 3 years. I think you need to give this medicine a try. Well, she was open. She was receptive to it because I said it tested 25% on the RGCC. I said, that's very high. I said, that's 1/100th of the leaks. So I said, let's do this. And I said, I have seen over the years that just giving an estrogen blocker can shrink the cancer. So we might as well give it a whirl, especially in the first year when you're trying to get a hold of this 10-year disease. You want to do every single magic bullet that you have to create this anti-cancer environment. So that is one of them.
Okay, good answer.
So it's very important, like Dr. Roney already said, to use just natural progesterone. And there's many studies after. You do not want to use synthetic progesterone. I never have used it in any of my patients because I've been using that. And so we talk about this one study that was used with with estradiol and medroxyprogesterone. And you had increased breast cell proliferation. And there's many studies. Well, that's a whole nother,
Right.
believe me, that's a whole nother talk that
Yeah,
we'll do
right.
on hormones, because it's, I literally detail every single study. And so anyway, but if you used the progesterone, there were no increase in the proliferation. So always just use natural progesterone.
And that, I think that's what you were
Right.
referring to.
Yeah. And there's, I have so many,
One of them,
a
right.
lot of them. It's a lot of studies that, because I think it's very important to see the timeline and the history.
Mhm.
And so anyway, here's 1,000+ women treated for infertility, and they were the lowest progesterone levels had the 5.4 times higher risk of breast cancer. So, and 10 times as many deaths. So I tell people, and I use this in all my lectures to doctors, it's not just for breast or female cancer, it's for all cancers combined. Because why? It is an anti-growth hormone. All right. And that's why it worked on my doctor friend whose mother had renal cancer. All right. Here's another study. Alone, if you just use estrogen alone, it increased the breast cell, but as soon as you use natural progesterone, it decreased the breast cell
I still see
proliferation.
patients come in with just estrogen.
Estrogen. So
It's
you should
unreal.
never take estradiol or any estrogen without it being balanced with progesterone, even if you've had a hysterectomy. So every woman needs to understand that progesterone has so many beneficial factors, and they should always be taking progesterone with their estrogen if they are taking it for menopause.
You could just do the progesterone, but
Yeah.
never do just estrogen.
That's correct.
Without the progesterone. Is that fair?
That's right.
Yeah. Okay. All right.
So, it's amazing
Alzheimer's, stroke.
neurological, like I already told you, they use it for patients who've had traumatic brain injury, stroke, especially Alzheimer's. Alzheimer's is, all the hormones, we're learning all that. Progesterone induces your brain-derived growth factor. Pregnenolone, which is the major progesterone metabolite, plays incredible role with neuroprotection for cognitive and mood. In fact, I just read a report how pregnenolone was beautiful for patients with postpartum depression. So I'd never read that. And so that was really wonderful to hear that, because that's something. And pregnenolone, which is the grandmother of all hormones, has absolutely, I've researched this there is absolutely no negative side effects or negative potential of pregnenolone. So progesterone helps you sleep, calming, natural diuretic, helps metabolic rate, so it helps with your weight. It's an antidepressant. Okay. So endometrial cancer is, one of the most common gynecological cancer. And this is really primarily from the lack of hormones being balanced. So what happens is when women go through their hormone changes, women start going through hormone changes somewhere between 30 and 35, 40, something like that. Every woman's journey is different. But after 40, things really start changing. So that's why we were waiting too long for patients to get their hormones checked. I know a lot of women are getting more aware of their hormones now today because we have so many environmental factors that are creating lots of hormone disruptions. And so we know that the biggest cause of endometrial cancer is not enough progesterone. So, and women just don't get good hormonal consultations that they know all this. I mean, and this is very, very, very important information.
To that point too, I was talking before you came in that the hormone imbalances are almost always secondary. They're not primary. They happen because of the environment. They happen because of stress. They happen because of, right? Fair?
Right. It's the perfect storm.
Yeah.
So we can't always put one underlying factor. That's why we do this comprehensive workup. I'm going to be 65 this year. I'm still trying to look for a simple, easy way of doing things and investigating things. But the more I know and the more that I research and the more that I read, everything is getting more complicated. So you guys have to bear with us. That's why we're doing these cancer conversations. So we slowly, give you and deliver the information. And we're already learning. So breast and prostate, prostate and uterus, I think they're kind of all very, very similar. Breast cancer, most common cancer in women. And prostate, I would say those are the top two cancers we probably see is breast and prostate.
Yeah, sure.
And both cancers are typically driven by estrogen, either your own estrogen that maybe is out of balance or the estrogenic possibilities from the environment. So like we already said, when a man is young, you're making good balance of testosterone and estrogen. But as a man ages, we already talked about that. You're going to have higher estrogen. So we always are auto correcting all that. Men and hormone changes. Yes. So we have a lot of as like you see men, hormone levels, even they can even have low testosterone and still have estrogen imbalances. Just because they have maybe low testosterone doesn't mean. That's why when I do a panel for prostate cancer, I am checking every single thing, androstenedione, the DHT, which is the bad one. Anyway, so you see, it's just the whole hormonal milieu is critical for us to be evaluating.
Leave no rock unturned, right?
All right. So, when we are doing anything, you have to do, a doctor's got to do a comprehensive history and physical exam to look at your body. They've got to do comprehensive blood work. What I see from all over the United States, that a doctor does a chemistry panel, a CBC, and maybe a lipid cholesterol panel. They do not do all of this testing, not even close to all this testing. And every single part of it is important. And just like, for example, the CRP I mentioned here, the C-reactive protein. Well, if you have inflammation is the precursor to all diseases. Now, we use thermography here. It's not the only thing for breast imaging and or body imaging. We do thermography because thermography shows vascularity. Thermography has been around for about 70 years, 70. And so it is something that is a very powerful tool, because think about it. When you're less than 40, you really don't have any screening tools. A woman gets a pap and a man gets nothing. A woman may get a mammogram, but a mammogram will typically become normal, especially in young people. And so I always add ultrasound to a annual imaging along with thermography. And so thermography tells me the vascularity. Cancer has blood supply. And so we know that there's something wrong because there is no vascularity in the breast. And so there's not arteries and veins going there through it. So if we know there is blood supply going, then we know that there is a problem when they do measure the temperature patterns. All right. And then the bioimmune, which you guys heard about from Molly last week, and the 3D body scan. So these are all things to tell us that, like in blood tests, you can't pick up energy, okay? And blood test captures a minute of time, and it doesn't check the bioenergetics of the body.
Right.
So, I didn't learn this in medical school. And when I first learned about it, I thought it was a little bit out of my comfort zone.
Right.
But then once I learned about it, I was like, oh my God. And now all you hear about is energy for this and energy and this thing. I mean, all these new things coming out that are delivering energy to your system.
It's all about trying to get the most information, right?
Right,
We possibly can.
right.
All right, gang. So let's go into the Q&A and see if what we can do here. So endometrial hyperplasia, its causes and how to prevent it from advancing into cancer. That's the
Right, that's a
estrogen.
great question. Okay, so if you have that, I don't know if you're a patient of ours, but if you're not, you need to be. And that's, I don't know how old you are, Deborah, but immediately you need to get on progesterone, but we need to also evaluate your eating, your diet. Do you have fatty liver? Let's look at all your hormones. And progesterone can very much control hyperplasia. So usually I give my patients time release progesterone. Obviously you can't do this by yourself. You're going to have to, you're going to have to see a practitioner to get all that balance, because what are all the external causes that are creating this? Is it just a hormonal imbalance? Is it your eating, is your eating balanced, and are you eating, the right balance of food?
Not a lot of sugar,
Is your body toxic? Because a lot of toxins, there's the group of xenoestrogens. Xeno is the Greek word for foreign estrogens, and they're everywhere in the environment. And so, that, I would do a cleanse. I know you guys have talked about the cleanse. So, things aren't just one cause.
Right. There's no smoking gun.
Yeah,
Rarely.
But listen, let me tell you, I will give you all a word of warning. And I tell this to my staff, and I have a lot of young people that work in my clinic. And I will tell you, anyone, and I tell my children, that health is your number one value. It has to be. Because if you don't have your health, you don't have an existence. Number two, you can't be a good family member, whether you're mother, father, sister, brother, whatever. Right. And you can't be a good member in your job. Yeah. And then you can't be a good member in community. And we all of us should be synergistically trying to help each other be the best we can be. And so I will tell you, whatever you resist persists and gets bigger, but you must address your health, and don't think you're just fine. If you think you're just fine, you're guessing. You need to verify that you are optimized, not okay, but you are optimized. Mm-hmm. Anyway, if you have CTCs from OncoTrace with no known tumor, when do you make the decision to a CAT scan due to the amount of radiation? That's a very good question. So if you have circulating tumor cells, that's a very serious issue. So you need to be, rotating that. And then what I would do, instead of doing a CAT scan, is I would get a whole body MRI without dye. They don't do it with dye now, the new MRIs. So I'd get a whole body MRI without radiation. And I love Halen. I've known about Halen a long time ago. That's genistein. It's a very great product. It's actually covered by people's insurance now. So it doesn't taste that good. So they added mint to it now. But it is a great product. This patient says, I'm on tamoxifen. Does it cause osteoporosis or any bone density problems someday? That's a great question. Mm-hmm. So yes, there is potential problem. So you should have, I don't know how old you are, but you should have a bone density test to see what your bone density is, because that happens with or without tamoxifen. Mm-hmm. And you need to take the proper nutrients to rebuild your bones. And you need to do weight-bearing exercises to strengthen your bone. Probably one of the single most powerful longevity is how much muscle you have. And us women, we have to work on it. When men kind of naturally have the muscle, I know Dr. Roney works out like a fiend, but I do weight-bearing. I do weights 3 times a week. So I don't focus on the cardio. I focus on my weights that I do, my push-ups, everything. You guys, I'm not dying to do it. Trust me, when my alarm goes off at 5:40 in the morning, I'm not, but I know it must be done. I don't have time during the day or after work. You have to do it. There is no way of getting out of it. If you feel your arms and they are not muscular, you better get to the gym. Do some, do some YouTubes. If you don't want to go to a gym, there's YouTubes on
Plenty of
this.
stuff out
There's
there.
plenty
Band
of
work, right.
information. So yes, and she said to detox. Well, I kind of believe that we need to be doing some kind of cleansing. Well, first of all, you need to, if you take a medicine, you need to be protecting your liver. And you can be doing infrared sauna. You can be doing
Your baths,
your
Epsom
baths.
salts.
You can be doing either I like zeolite. Zeolite's been around for a long time. So you'd have to take it the opposite time of day. You take your tamoxifen. That is a very good question, and make sure that you're doing all the counterbalancing measures. What can be done about liver lesions? Very good question. Well, first of all, is it cancer? If it's cancer, you might be able to do cryotherapy. They do liver ablations. There's all different procedures. There's a great doctor that I use at UCLA that does cryo. Sometimes chemotherapy, conventional chemo or low dose chemo will work for liver lesions. And so, but it has to be addressed. If you are NAD means no evidence of disease when taking the RGCC test, and it shows you have no circulating tumor cells. Will you still get reliable results for chemosensitivity? No, you won't, unfortunately. So sometimes there are no circulating tumor cells. If you have a tumor, and it hasn't been released out into the circulation, and I see this in about probably 1 in 500 cases, I'll see a patient with no circulating tumor cells. It is very, very, very rare, but I will see it. I always tell people, nothing is perfect. That's why you don't do one blood test. That's why you don't do one scan. That's why you don't just do the bioimmune survey. You do it all, and you get the most information of what you need to do. So I would say if you have NAD and you've had cancer and you have NAD and you have no circulating tumor cells, I would probably do some other testing to see what else. And I would definitely do a bioimmune survey to see what you don't see. So the bioimmune survey, with the acupuncture points that Molly talked about last week, will tell you the invisible that you need to address. I hope that answered your question.
June, this was a case that I shared. So it was invasive, June. So she asked if the case I shared was invasive or non-invasive DCS. It was invasive. So that was just something that a case that I shared.
Okay.
All right. So Marley, let's see.
So should an
Water.
average person who's water only fasting for over 15 days be supervised? Well, I have recommended this to patients. I've just told them what to do. And I think you can do it by yourself personally, but I think if you want to, you should connect with a physician who can help you. But all the patients that I've had do it have done very, very well on their own. But there's something called True North that several of my patients have gone to. I think it just depends on what your personal needs are.
Yeah, hypoglycemia, if your cortisol is a bit off, there's some factors there that probably, you should have looked at to make sure you can do it.
Right. Exactly. So a young child fasting, I don't know. I don't know about that situation. I don't know the details. I don't recommend fasting to anyone who is underweight or doesn't need to lose weight and has a medical problem. I only recommend fasting to people who have already plenty of extra weight.
Right, exactly.
But someone who's thin, I don't recommend fasting. Is
So-
Zoladex suggested? Sometimes, yes. Sometimes it is suggested. My 32-year daughter had breast cancer, estrogen, HER2 positive. Her tumor marker went up from 50 to 200.
Should be looked
Well, that should be looked at
Yeah,
immediately.
right.
If her tumor marker, well, tumor marker 50 is high, 200 is super high. So you need, and especially at 32 years of age, 32 years, a person who has a cancer, the cancers of young people are much more aggressive, and those patients must be watched very, very closely. Sometimes monthly in the beginning, I will watch a 32-year-old. And once I have them managed and they are on a very, very tight program, I'll let them go 3 months. Then I'll watch them probably every 3 months for 2 years. And then I will let them go 6 months. So obviously, every one of these patients is very different, but a 32-year-old must be watched very, very carefully and closely.
Mhm. All right. So
So
Karen asked about statistics on
So
success.
I always
right?
tell people statistics. Everybody's their own clinical trial. If you look at statistics in medical journals, 47 out of 53 can't be duplicated after 50 times. Amgen, which is one of the largest pharmaceutical companies in the world, did a retrospective analysis of oncology publication. Like I said, 47 out of 53 could not be duplicated after 50 times. So be very leery. I always tell people, did they know what the patient ate, their lifestyle, their stress, their personal circumstances? Did they look at their blood work? I mean, the variables for every human being are staggering.
Right.
So I tell people, everyone, because we know that if you have a label of triple positive breast cancer, I know that every single one of those patients is drastically different. And why? We already know the layers of the mutations of every patient's cancer is unique to them. That's why when we do conveyor belt medicine and we give patients the same thing all the time, some patients do well, some patients don't do well, some patients kind of do well. And so you cannot possibly put everybody in a cookie cutter program and expect them to work, because the biodiversity, the heterogeneity of a cancer tumor is outrageously diverse.
Right. And then here, Doc, I'll add to that. Every patient is treated as an individual.
Right.
So when you're doing a scientific experiment, trying to figure out statistics, if you will, on this and that, you'd have to do the same thing with each patient to get an analysis.
Right.
That's impossible for us to do. That's not a cop-out answer.
Right.
That's
But
the
that's an
exact truth.
impossible for a drug company to do, because I've had
Right.
plenty of my doctors that have worked on clinical trials.
Right.
They don't know, they don't ask what the patient does every day. Do they exercise? What do they eat?
Yeah.
I mean, no one goes through all those extreme questions.
What I tell patients, and you tell me if you agree, when you look at the 4 pillars that we put together and all the details that we speak about, if you can find something that you feel is better, or use us in conjunction with
Yeah,
this,
I'm
then
signing
do it.
up.
Then
Yeah.
do it 100%. Because all you can do in life is put a plan together that maximizes your upside.
Right.
Is that fair?
That's right.
You have to do the research to feel, well, what is that upside and what is the plan that's going to get me there?
Right.
Right? That's the best we can do in life, my opinion. Okay.
What is your present Hashimoto's in an average non-cancer person? Well, first of all, you're probably not average. You're probably amazing. And so Hashimoto's is an autoimmune disease of the thyroid, where the thyroid starts attacking. So the first thing is make sure you get a good food allergy test, because when you're eating the same foods, you don't know what could be, even though you might not have symptoms, food today is not sacred anymore. So I would make sure you don't have excessive food allergies. And if you have food allergies, you should be avoiding those foods. Then you may need, there are very specific supplements that help Hashimoto's. So like selenium and tyrosine and iodine and, all kinds of everything. Then you got to make sure you've done a cleanse so you don't have toxins that are contributing to the Hashimoto's. Then you got to make sure you're not exposed to too much EMFs, because the thyroid is very sensitive to electromagnetic fields. And then, I always make sure that I do a thyroid ultrasound on every single one of my patients, since thyroid cancer has gone up about 30% in the last 10 years. So again, like I wish there was just like one simple thing for
Yeah.
everything, but it's not like that.
I'll add a quick antidote to that. The same things that would help you prevent or heal from cancer are very similar to autoimmune diseases.
Right, exactly.
It's very similar.
Very similar.
So everything you're learning here, Marley, in this conversation, you apply, and I see some of your other questions as well. Apply these strategies: good eating, good exercise, clean the liver,
Sleep.
detox the liver, get good sleep, make sure you don't have molds, make sure you don't have chemicals, make sure you don't have da 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 da. All the things that you're learning here, if you apply that to you and your family, you literally give yourself the best chance to keep the fuel down and the fire down. And that's best advice I could give you. Hopefully that helps.
Right. Now, someone asked about family and
That was her.
Oh, okay.
The
Yeah.
same idea.
Yeah,
It's
and
all the good
Yeah,
things.
I started this literally 30 years, well, I would say 30 plus years ago when I had my first child. And so luckily there wasn't excessive EMFs during that time.
Mhm.
But I nursed, I made my own baby food, I did everything, I made sure everything was pure, pristine, etc. My book, Be Perfectly Healthy, I talk about a lot of these little things. Like yesterday, I had a patient fly in from South Carolina. She's 35 years old, 4 children. And so we were talking about like the lunches, and we were talking about, well, I said, do you use wax paper bags? And she goes, oh no, I use Ziploc. And I said, no, you can't use Ziploc. It's plastic. It's full of phthalates and xenoestrogen. I said, no, just go buy a huge thing of wax paper bags. So anyway, just simple little things. Like I only used wax paper bag and paper bag. Not a lot of those containers, there's plastic, all kind of things that they're not good. They're not healthy.
Minimize your downside. Right?
Yeah, and just be simple.
Yeah. Liver spots.
Yeah. So the sun, liver spots on the skin mean the liver's having a hard time. Yes, you're right. And you need to do, well, it's not just from the sun. It probably, I tell people skin is your largest organ. All right. And your skin is a reflection from the inside out. So if you want to worry about your liver spots, you should be taking lipoic acid 1 twice a day. That's and do a liver cleanse and do an overall 21-day cleanse, which focuses on the liver to kind of jumpstart. Almost unfortunately, everyone we see, we know. I can look at the whites of your eyes. If your whites of your eyes, go look at your eyes tonight. If the whites of your eyes are not white, the sclera is white. And you'll see, like in very young people, because they haven't lived that long, they have very nice white eyes.
Right,
but but as we age, you look at them and the eyes, the sclera are if they're injected with red blood vessels, we know that your insides are not good. And so have someone take a picture of the whites all the way around 360 degrees, and you'll see that you'll be able to see the assessment of the insides.
All right, a couple more.
What does estrogen positive mean? So that means estrogen feeds you. So the estrogen feeds this cancer. So you cannot take estrogen, and you need to get on something. I'm not sure what they're going to put you on. You're probably not my patient, but you need to be properly assessed, not just for estrogen, all your hormones, because they all work in an orchestra. And so one affects the other, but it means you can't take estrogen, number one. And number two, you will probably need an estrogen blocker of some sort.
All right. So can you send a piece of tumor to RGCC?
I don't think so.
Yeah, I don't think it is either.
But I know that there's places that you can do that. So I think Neo7 does that.
Yeah, right. Yes.
Okay. I don't know.
Last one. Bioidentical, 5 years without a period, have stable polyps and gallbladder, stable liver enzyme, toxin in my blood.
Chronic HDL, small, stable nodule on thyroid, hip pain. Oh, you need to see us.
Yeah, right, exactly.
You need to see us. I don't know how old you are,
Right.
uh,
So, yeah,
but
that's just a lot of,
that's a lot
definitely
of
a lot.
things.
That-
And I'm not sure you never had cancer. I don't know if you had cancer or not, but you could, if you haven't had cancer, you could do bioidentical hormones.
Get it tested properly first,
Yeah.
see what's going on.
You know, and then
Yeah.
you got to deal with the mycotoxin, the source of the mycotoxin, and then the mycotoxin in your blood. And then all of these things can pretty much be fixed. And then the nodule in your thyroid, I don't know, we got to look at
Yeah.
ultrasound and see. And arthritis, there's lots of things. I know I have arthritis and you should see what I do. And so anyway, so that's like a major workup. The body is not separated in parts. It's all interconnected to something else.
So hormone panel, main hormones, no matter what, would be the ones that were mentioned.
Yeah.
Everything from FSH, LH, DHA,
Pregnenolone, estradiol, total estrogens,
Yeah.
progesterone, testosterone, all of those.
Mhm.
Yes.
Yeah, all the ones on that one slide. Okay, I know we're way over.
Oh, we're
so-
way over? Okay.
Yeah, all right.
Anyway,
so-
thank you guys. Please share this so people can become enlightened and illuminated and educated, and so that we can change more and more lives.
Gang, have a great week. Okay, we'll see you next Wednesday. We'll let you know what the topic is. I have a couple ideas that we want to do. Just so you know, if you're wondering about patient inquiries, if you're thinking about coming here if you have cancer, active cancer, you'll dial the 949-867-6374 or use the Cancer Center for Healing website. Okay, if you're prevention or trying to prevent reoccurrences, or you have optimization, autoimmune, that's the center side. That's the 949-867-6419 and the cfnmedicine.com. Anything related to the store, it's the shop, cfnmedicine.com, 949-997-0821. So just remember, if it is cancer, that's the Cancer Center for Healing side, and that's Dana. That's 949-867-6374. She's getting a lot of calls, inundated with everything. So she just asked if I made it clear that it's one side versus the other. So I did her a favor. Okay, gang. Much love, everybody.
Thank you, guys. Any
great.
suggestions? You guys, we're
Let us know.
open to any kind of critique, but thank you for
we're
being
here for
part
you.
of our community.
Bye, guys. Much love. Be good.